Hip opener stretches. Yoga poses for tight hip flexors. Hello and welcome to the lindyyoga.com podcast. Tight hip flexors can be caused by a variety of factors. For example, if you sit too much or have poor posture, these muscles can shorten. This can cause lower back pain and affect the natural shape of your spine. If you find that your hip flexors are not as strong as they could be, you should see a doctor or physical therapist. There are yoga exercises you can do to stretch your tight muscles. The iliopsoas muscle is one of the most common culprits of tight hip flexors. It is the muscle that connects the spine to the lower limbs. When you sit all day, especially at a desk, the iliopsoas muscle shortens. Some athletes, such as runners, are also prone to tight hip flexors. Because of their repetitive movements, the iliopsoas shortens and can't compensate for the lengthening motion. Tight hip flexors are a common symptom of overworked muscles. They can be a sign of hamstring stretching and lead to other health problems. They can also indicate problems in the core, pelvic floor, and back. It's important to understand what causes tight hip flexors so you can treat them appropriately. Using a foam roller is an inexpensive and effective way to stretch your muscles and relieve pain. Inverted plank positions with the foam roller under one hip and rolling your hips up and down are two simple and effective stretches for your hip flexors. You should try different yoga positions. One of them is the pigeon pose, where you pull one knee forward and extend the other backward. Hip opener stretches to prevent tight hip flexors. Tight hip flexors can be quite uncomfortable, especially if you spend most of your day sitting. Even if you don't sit for long periods of time, it's important to keep your hip flexors loose and relaxed. There are a number of causes of tight hip flexors. One of the most common causes of tight hip flexors is poor activation of the abdominal muscles, which can lead to muscle spasms and pain. The best treatment for tight hip flexors is to strengthen them and protect them from injury. You should avoid lifting heavy weights if you suffer from tight hip flexors. This can lead to injuries that make it difficult to maintain an active lifestyle. To determine the cause of your tight hips, a doctor or physical therapist will perform a thorough examination. There are a number of causes of tight hips, including muscle tension, joint arthropathies, and lifestyle factors. Manual therapy is an excellent treatment option for tight hips because it mobilizes the soft tissues and improves circulation to the area. Read the full article, Hip Opener Stretches, 6 Yoga Poses for Tight Hip Flexors on www.lindyyoga.com. With how-to yoga videos. Just click the link below the video.